We are going to take you live now to Queensland, where Health Minister Stephen Miles is providing a coronavirus update.
Yeah, so what we'd be looking for there is growth in cases. So it's not so much a problem that we might have 10 a day or 20 a day. It's about how rapidly it was growing. And certainly our hospitals are very well equipped to deal with those kinds of numbers every day. The concern would be if you started to see exponential growth, and particularly exponential growth in local acquisition, exponential growth in community transmission. So that would look more like 10, 20, 40, 80 than a steady level. At its peak of that first wave, we were escalating up to kind of 60, 70 a day. We are very well equipped to cope with those kind of numbers every day. What the concern is and what we'd be looking for would be growth in cases. And certainly if we saw growth in cases in a local community, well, we could respond very quickly in that one location without necessarily having to put restrictions back in place for the whole state.
We've seen a new trial of arthritis drug treatment. How important is it that we keep pushing ahead with treatments like this, even though restrictions being eased?
Yeah, Australia and Queensland in particular, we're really uniquely placed to be part of the response because we're not facing the kind of outbreak that other places are. Their institutions are facing the same challenges that the rest of their society is, that comes with this massive outbreak, this uncontrolled outbreak that they are experiencing. And we're also really fortunate here in Queensland. We are home to some of the world's best research institutions. We are at the forefront of vaccine development. The UQ vaccine is considered one of the leading candidate vaccines, but we believe it's likely that we will identify treatments before we have a vaccine. At least we hope that to be the case. And QAMR Berghofer is leading the effort to test treatments and determine which might help us to treat people. And so they've been at the forefront of that from the very early days, and I look forward to seeing how their trial of this particular drug goes. One of the challenges, though, is because we have so few cases, we don't have many patients to put into these trial programs, and so that's a challenge for our researchers, but one we're pleased to have.
Since the restrictions first started to be eased about a week ago, is this coming week the real test of how successful or otherwise that is?
It is. We'd expect to start to see cases really from this weekend if there had been transmission last weekend, and so I'm really heartened to still be reporting those very low levels today, but it's really as we get into this week that we can be sure that there hasn't been an outbreak caused by that easing of restrictions. The easing last weekend was very, very slight, and so we are very confident that we are unlikely to see an escalation from those. We're equally confident with the Mother's Day measures. Containing them to one household doesn't really increase the risk of transmission very much. And similarly, next weekend is another small, incremental, but really important step. It will be in place.
That was Health Minister from Queensland, Stephen Miles, reporting 0 new cases in Queensland.